Rich Hudson out in Washington, thank you very much. I want to bring in Republican Congressman Steve Scalise of Louisiana. Congressman, Mike Pence, Congressman and Chairman of the Republican Conference, talked with Fox News Radio this morning, and he made a really interesting comment. I want to ask you about this. He says basically the American people don't want a government takeover of health care. They don't want one full of special breaks for some states at the expense of every other state. He's reacting to some reports earlier. There's a lot of backroom deal making on the Democratic side, and some strong words from Mr. Pence. Do you agree with his assessment that the deals are still happening behind closed doors and that the American people don't want that?
Well, Cheryl, I strongly agree. And if you look all across the country, the American people have been consistent, saying they don't want a government takeover of health care. And we all agree that there are reforms that we should make. We need to lower the cost of health care. We need to address pre-existing conditions. But people don't want this bill. They want the president to start over, and he continues to ignore what the people want.
All right. You know, Mike Santoli, as we've looked at the back and forth with healthcare, the president has been very strong in going after health insurance companies, not backing off of that rhetoric. But at the same time, doesn't the president need the health insurance companies to somewhat play ball?
There's no doubt about it. And you need the health insurance companies to kind of form the infrastructure of whatever plan comes out there. And I think it is interesting. The market has shown you that they're not afraid for HMOs under any of these scenarios here, mostly because more insured, more customers. And I also would point out the HMOs are in the business of trying to control costs. They can't do it successfully all the time, but it's in their interest to basically be the ones pushing medical costs down.
I was going to say the thing that's sort of disconcerting at the moment is this whole make your head explode trying to figure out this procedural stuff. And it can't be doing the Democrats any favors with the perception of this bill already bad out there among the public, wondering if this is in fact being pushed through by quote unquote sleight of hand. Maybe the congressman can address that.
Address that, Congressman, and also I want to hear what constituents are telling you in Louisiana.
We had another town hall meeting yesterday morning before I flew back to Washington, and people again were strongly opposed to this bill. We didn't have one person in the room that wanted the president or Speaker Pelosi's bill. And I think people are even more disgusted now with this latest proposal, the slaughter solution, where they're going to try to go and pass the bill without even a vote. This is insulting to the American people. It betrays the trust, and it goes against all the transparency promises that the president and Speaker Pelosi made. In fact, when they kept saying, oh, all this would be on C-SPAN, they're meeting right now behind closed doors, cutting even more sweetheart deals. And the American people know this is going on, and they're disgusted by it. And I think that's why you're seeing such a backlash against the president's government takeover.
Well, Congressman, first and foremost, we still don't know what this thing is going to cost. We're still waiting to hear from the CBO. Isn't this all for naught until we get some kind of cost structure for this bill?
Well, we surely should know what the real cost is going to be. We've already seen there's going to be over $500 billion in new taxes, $500 billion in cuts to Medicare. But if you look at the overall cost, we know it's going to be well over $1 trillion because their bill has 10 years of taxes with only 6 years of expenditure. So if you look at a true 10-year cost breakdown, it's going to be over a $2 trillion cost. It's going to add to the deficit, and then it's going to raise tremendous amount of taxes on small businesses and small businesses and middle-class families. This is not the direction we should be going. We should be creating jobs and lowering the cost of health care. Instead, their bill raises the cost of health care, and with all these new taxes, will cost more jobs in the economy.
All eyes on the CBO, Congressman Scalise from Louisiana. Thank you very much, Congressman. Great to have you on Fox Business.